Topic, okay, my thesis is about Malaysian bioethics, leads and disputes, okay, a biohistorical and authentic perspective. I call it biohistory because actually it is my journey through bioethics since 1992, and of course in the research topics that I have supervised among my students, you will see that many ethical dilemmas, okay, actually become leads for the progress in science and technology, but at the same time they also become disputes, and the moral dilemma sometimes stays. Okay, so I am now the founding director of the University of Malaya Center for the Initiation of Talent Industrial Training. So what we do here in the center is actually make sure that every student in the University of Malaya attends compulsory courses on soft skills development. So, and then one of the soft skills development that they have to, of course, achieve is critical thinking and decision making skills, and also time management as well as human resource management. Alright. So, okay. So the objectives of my study will be to present a study of bioethics discourses in Malaysia. I'm going to, of course, the focus will be on masters and PhD thesis developed, okay, from the University of Malaya. I will not be, of course, there are many debates and discussions in public. I will not be attending to those because I have a reason for this, because I believe that those topics which has been presented in thesis have made the students or the candidates themselves become bioethics experts. The way they argue, the way they thrash out the issues and come to a conclusion, it's sort of a training skill for them. So I believe that students who graduate with a master or PhD in bioethics are actually bioethics experts. Right? In Malaysia, probably bioethics experts are not as well known as they are in the USA. For example, there are bioethics experts like Edmund Pellegrino, the late Edmund Pellegrino, and many of them sit on the Bioethics Advisory Committee, which actually advises the US government regarding stem cell research and all the bioethics research. But in Malaysia, bioethics experts are gradually not known. Today you heard Professor Siti mention something about the National Bioethics Council in Malaysia not being very active. It is so because there is not enough funds. Alright, anyway, regardless, nevertheless, the bioethics experts are actually there, hidden in the thesis. Alright. So I will just highlight interesting findings on the nature of these discourses as presented in the thesis, and to define and clarify different bioethics approaches. I mean, there's a very rich area of approaches in bioethics, and I also want to show the significance in attending to moral disputes and how such research facilitate our healthcare services. Alright, okay, the Hippocratic Oath is about doing no harm. So how do this bioethics discourse actually contribute to address the values behind the medical profession? So every topic for the ethics or bioethics debates or discussion would have policy implications. Okay, in Malaysia in particular, usually the government will organize a public forum. For example, there was a public forum when IVF was first introduced in Malaysia, and there was a public forum when the whole world was debating on human cloning technology, and then there was also a public forum when organ transplant technology became, medical necessity. So the analysis of ethical problems would have policies implications. Alright, whether or not to go ahead with such science and technology innovations. So in understanding human behavior, it is not behavior, alright, we are just understanding their attitudes, their predispositions, their value, statements regarding certain, science and ethical dilemma, and then how will the government or policymakers, progress from them, correct? So the way governments employ the services of economists, to make decisions about how to make decisions during economic crisis and uncertainty, by the use of intelligible theories, the same way bioethicists, are required, because these are experts who can provide the best advice on morally related issues. And then they are experts because they can actually utilize several resources, very important resources, whereby they intelligibly make sense out of those resources. So M.N. Pellegrino, for example, a well-known Kennedy, scientist from Kennedy Institute of Ethics, okay, the late M.N. Pellegrino, was actually advised President George Bush on the dangers of stem cell research. For a while, okay, U.S. government stopped, okay, the production of stem cells based on M.N. Pellegrino's advice. But I think they probably have, there is a new committee now on board, but they are actually, monitoring how stem cell research activity is being forwarded. So a bioethics expert is someone who has expertise in the academic field of bioethics. So and their views actually are more likely to be correct than those of non-bioethicists. Today we heard a statement regarding, what do you think about human rights? So it is just a question, but a bioethicist, okay, will actually conduct research, get some literature, okay, really analyze all the sources and come up with some maybe clever critical thinking of the subject. It is not about saying is this bad or wrong. It is about how the topic is being so documented, being discussed and argued, in this sense come to a neat closure. So the skills and the knowledge processed by these bioethicists, okay, can contribute in other ways that stand to significantly help the clinicians, the patients, and also the researchers themselves. And of course, the policy makers will choose the morally correct course of action. That is why we have many public forums on bioethics, because the government do not want to make a bad decision regarding new SNT innovations. Alright, these are the skills. Okay, bioethics expert will have, the skill of moral reasoning. So the bioethicist must not only have good general critical thinking skills, but he or she must use specific critical thinking skills applied to moral matters. Okay, how to employ morally relevant theories and analogies. Okay, and clever use of counter examples, how to distinguish between morally relevant and irrelevant cases and features. Alright, okay, the knowledge that bioethicist expert must have will be the moral arguments, okay, how to argue morally. What are the complex reasons for and against all the moral propositions, and what are the theories, okay, and the concept or even cases, okay, similar cases which you can fall back to and sort of make an analogy. So it will be an intimate knowledge of medical, legal, social and cultural, economic and historical facts regarding the story, regarding the dilemma, and then put them all nicely. So in the end, a thesis will be produced. Alright. So these are the general research questions. Okay, the general research questions that students often ask is it good for the whole of mankind? Is it IVF or stem cell research, organ transplantation? Will it be good for humankind? But in Malaysia, students will be asked to ask, is it good for that nation? Okay, because the values in this nation, in any nation for that matter, will be different from American values or British values. So they have to address the values, okay, currently residing in the nation. Or does it bring about social disorder? For example, the question of surrogacy, okay? Surrogacy maybe have a different set of value assumptions in Malaysia rather than in the USA or the UK. So, and then certain thinking regarding surrogacy will in the end sort of develop some certain laws regarding that, regarding the topic of surrogacy. And then does it bring about cultural or legal implications? Okay, sometimes surrogacy has questions leading to the rights to inheritance, so it will have some legal implications. But other questions, okay, maybe, but questions such as, is it the right or good thing to do? Okay, what are the obligations, what rules or guidelines? This is not the focus of the academic thesis. This is not. Okay, you're not. I always remind my students to sort of refrain from being judgmental, because these are judgmental questions. Okay, students should not be that. Students should have an impartial outlook of the topic. So bioethics research usually include a mix of disciplines such as philosophy and theology, science and medicine, social anthropology and law. Social anthropology is very important because it is about the value assumptions in the society. Alright, understanding the society where the problem comes from, okay, is very, very important to address, okay, in local thesis. Alright, today we heard Professor Siti mention something about, yes, philosophy is important. Okay, so do philosophers teach bioethics, alright? But at the same time, do we prevent clinicians from teaching medical ethics? So there is a very, very tricky and delicate question which I do not have an answer. So, and then bioethics, of course, everyone knows what is bioethics. We discuss about life itself, the ends and purpose of biomedicine, say the meaning of death, what is pain, okay, what are the rights and responsibilities. So those will be bioethics questions. So, the research methodologies implied in thesis are several, okay. The most important is empirical findings, okay, usually, because empirical findings are where students get raw data. They get data and they try to make sense of those data and in the end come to a conclusion, alright. So, so empirical findings are analyzed to obtain an overview of the people's sense of morality, okay. Bioethics dilemmas, okay, try to understand the people. Okay, people regarding their sense of morality, what do they think? What are the values? What do they think about life or death? What do you think? Do you think about pain and suffering? Okay, so it is a combination of qualitative and quantitative methods actually, and this actually reveal a deeper insight in human ethical behavior. And actually also bioethics, in bioethics, can we encourage students to question dominant behaviors. Sometimes behavioral patterns must shift. For example, the meaning of death, okay, has got a different definition today after bioethics came into the picture. Today, death is determined by the termination of the brain function. Before, maybe doctors would listen to the heartbeat, but now it is the termination of the brain function. Alright. So these are the challenges faced by bioethics scholars. Impartiality of value assumptions. Okay, they have to be impartial most of the time. And then students must not be afraid to challenge moral theories, okay? Theories such as utilitarianism, okay? So students should not be afraid to challenge these theories, alright? Then we have something refreshing and new to actually contribute to bioethics literature. And, okay, I'll just proceed. So in biomedical ethics, the value of empirical research data is substantially supported and argued for. Alright, so empirical research is useful for the following purposes. The description analysis of the moral conduct of a group with respect to a morally relevant issue. I'm going to show you 3 issues now. Next, okay, one is regarding embryonic stem cell research. The second is about the use of PJD, pre-gamete diagnosis technology on unborn infants. And then the next one will be how infants with DSD, undifferentiated sex, okay, or sex organs, okay, how decisions are made regarding what sexes the baby is going to have, okay. Alright, so I'll just go on, okay. Okay, the significance of research in ethics is the social acceptability of scientific research, okay. Do we in the end decide that this is good science and technology to adopt? And then that so that the bioethics experts can actually present or hand over to the policymakers some kind of thinking regarding the issue. Okay. Malaysian society is characterized by a rich plurality of ethical, legal and legal cultural traditions, okay? Okay, in Malaysia itself, there are 3 dominant religions: Islam, Hinduism and Buddhism. These are the 3 dominant religions, okay? Now, the cultural thinking and value assumptions are very different from these 3. So how do we come to a conclusion so that the government can make use of a common policy, for example, so to sort of advance the field of organ transplant, for example, right? So these are the type. Okay, now bioethics research. Okay, never mind. Let me just continue. Okay, for example, organ transplant technology, okay, was a bioethical issue. Okay, sometime in 2001, I believe there was a public forum on organ transplant. So they brought in, say, Hindu leaders, Buddhist leaders, and Christian leaders, and Muslim leaders. So everyone talk about organ transplant. Okay, but in Islam, for example, say organ transplant was, to get organs, okay, you need to conduct post-mortem. So there was a kind of, disrespect towards the sanctity of the corpse, okay. So, but then in the end, after the public forum, all the religions sort of agree that organ transplant is a good virtue to have. Okay, it is altruistic to help, say, somebody who is suffering, okay, from organ failure. So it is good to donate. So in the end, the conclusion was that All four religions believe that the norm of charity should preside over any other field regarding, say, organ donation. So that was one example. Okay. So alright, I just show you three ISI articles that resulted from bioethics research. Okay, so the first one is on the ethics of embryonic stem cell research according to Buddhist, Hindu, Catholic, Islamic religions. Okay, what the student did was to gather values, okay, or opinions from religious leaders. Okay, so because they are leaders, therefore their views are authoritative. Okay, in Malaysia, for example. So what she did was to actually ask them whether it is okay to create research stem cells, okay, stem cells specifically created for research purposes, or to use stem cells from leftovers, okay, leftovers of infertility treatments. So she questioned all those leaders. So the results, of course, was various, okay, but what she saw was that Islam, Hinduism and Buddhism actually supported stem cell research, but not the Catholics. Okay, the Catholics had very, maybe extreme understanding that life begins on day one, the minute, okay, fertilization occurs. So therefore, stem cell was a no-go for the Catholic. All right. What was interesting was that it was the first research that was documented to show that different groups had different, okay, thinking on the subject. Before this, policymakers took on the Islamic rule regarding when life began, which is 120 days. So therefore, research that is conducted on the 14th day after fertilization would be no problem. Alright. So, but the research actually sort of asked the Catholics and also all the other religious leaders to sort of rethink again about when so life begins. So in this case, it's about saving lives. It's about, you know, getting knowledge regarding the genetic diseases. So actually, the research actually opens up most perspectives, which now the religious leaders are trying to consider. So I mean, it presents a fresh insight, fresh start towards more bioethical thinking. All right. The next research is regarding religious scholars' attitudes and views on ethical issues pertaining to pre-implantation genetic diagnosis in Malaysia. All right. PGD, you know, alright, PGD, because say the implication of PGD is that once a mother say uses PGD and the testing shows that the baby has got say genetic diseases, the mother tends to want to maybe do not want the baby. So that was the ethical implication. But then PGD can also be used to sort of, you know, treat the unborn baby by so many medical say treatments today, right? Medical science is really advanced today. So but for a long time, PGD was not being encouraged because it's sort of one thing. Parents would like to use PGD to know the gender of the child. So when they want to know the gender of the child, there will be discrimination of sexes. Maybe some mothers would like baby boys rather than baby girls. So on that aspect, it was unethical. But what happens was that she actually thematized, she made themes of her research. Instead of asking what do you think of PGD, she says what do you think about the sanctity of human life? Okay, what do you think of the idea of play God? Is PGD has got something to do with play God? Or is PGD has got potential for discrimination? So she went along those themes and then she collected data on those aspects. So that's another way to do bioethics research. Alright now. And of course, the last research is regarding newborns which have sex development disorder, or what we call as intersex. It is whereby newborns present both sexes. So, say in Western medical ethics, decisions has got to be made very fast, and decisions are usually made on the chromosomal makeup, which is more dominant. All right, and of course, some say clinicians will say decisions ought to be made on which is the dominant feature. So, but what this student highlighted was that in Islam there are various ways, right? Sometimes it's about, there are many. Sometimes it's about the amount of urine excreted by the newborns, So this is a very important highlighting all the exploration of of, say, Islamic historical thinking on that subject, which was unexplored before. So this what's make the thesis original. Alright? So in the end, what the student did was present a new whole outlook regarding how doctors should view the problem of DSD. Alright? Rather than the traditional medical perspective. Okay, this student actually brought in the social-cultural, because for the Muslims, if a baby is to born a male, he will have to follow the male role in society. He's got to be leader. For example, he has got only males can be imams, whereas the female cannot be the imams. And then it's about the mingling between sexes. Okay, it's different in Islam because the males and female cannot mix freely. So there are many implications. So social and cultural implications are very important in any medical dilemma, even say for DSD, especially for a DSD patient. And of course, in the Western world, there are psychological assumptions also, because if a mother say prefers a boy, maybe the mother will tell the doctor, no, I want my child to become a boy, so please make him a boy. So and then so he will be treated a boy, but maybe teenagers or adults have actually complained that actually they do not feel comfortable being that gender which was chosen by the parents. So there are lots of ethical issues regarding this topic anyway. So of course, I like what Randy Fox said, the bioethics that I would like to see. Okay, so these are bioethics have got to be presented in fresh perspectives, whereby bioethics have also got to say allow non-Western bioethics thinking into bioethics literature. Alright, and of course encounters with empirical bioethics. How empirical bioethics, getting data on values of societies will actually contribute a lot or enrich the bioethics literature worldwide, internationally. And then this is about critical bioethics. We just seen the three cases. Those are critical bioethics, which actually has gone beyond just social science critique or applied ethics, but actually has gone beyond. Is a very interesting display of many values that goes into thinking of bioethical dilemmas. So, do you know what is normative science? Normative science is defined as information that is developed, presented or interpreted based on an assumed or usually unstated preference for a particular policy choice. For example, just now I was explaining, say the Malaysian policymakers would like organ transplant technology to be the state-of-art technology that is being used by doctors, to treat organ failure, for example. So, we do not want normative bioethics whereby all values, all religions come together to sort of promote organ transplant technology. We want religious leaders and organizations to sort of also present their own thinking of the subject, and they may be free to deviate from the common thinking of the subject. So we do not want a normative bioethics, the way we do not want a normative science. Alright? And so sometimes, often, whenever there is a public forum in Malaysia, the scientists will of course have a lot to say, because scientists are experts and usually the public look up to the scientists. So if the scientists will say organ transplant technology is is the only available method that can save lives, so the public is easily coerced into thinking, that is the way to go. But bioethicists has got a role to play here, because they are looking at several other paradigms, to judge, or actually not judge but assess, a certain bioethics problem. And so what Malaysian bioethics have done, from my observations, is that it does challenge international bioethics, and our empirical data actually offers fresh perspectives on the position of Malaysian bioethics in the global context. I think I've given you 3 examples. And of course, the academic understanding of biomedical research ethics should be developed both at the local level and within the research moment itself, during the moment, while the research topic is hot. While stem cell research is hot, it was hot during organ transplant, and while human cloning ethics is hot, it should be developed during that time. Then this is a way of enhancing or actually promoting the autonomy of a nation or of a society. It's no use starting from the Western thinking of what is organ transplant is, okay? But it's about, moving on a fresh platform, beginning on a white piece of paper. Okay, and academic bioethics will have to play a key role in this endeavor, and of course, indeed, contribute in important ways to open up new spaces of symmetrical engagement between the bioethicists, the scientists, and the wider public. This is the meaning of the democratization of the bioethical enterprise. We've yet to see that in Malaysia, but we are beginning slowly, and we can see that happening in academic thesis. And then, in the end of it all, what's the role of the bioethics? Okay, it is about supporting the Hippocratic Oath, the norm of do no harm. So, I mean, overall, okay, the medical enterprise must not do no harm. They must have the patient interest in heart, and that is essentially the role of bioethicists. With that, thank you very much. Thank you.
Thank you. Are there any questions?
May I ask what is the controversy and how do you propose to address this controversy with respect to your thesis?
What's the controversy?
Yeah, the paper is trying to evoke with respect to bioethics. So that it provokes critical thought, for instance.
I will be looking at many bioethical controversies, and I'm going to show that these controversies actually provide a platform where local bioethics can actually develop, and the local bioethics that is going to be developed is going to be very much different from international bioethics. All right. Okay, so it will be different from the human rights thinking. It will be different from the principle of autonomy. It's about democratizing our thinking, Okay, separating our thinking from the Western way of thinking through bioethics will be something new and fresh. That is what the thesis is all about. Yes.
Yeah. I'd like to know what would be your study, what would be its benefit to the community in Malaysia or in the world, and what is the impact of your study to the let me say legislation or policy enactment.
So first of all, impact. The impact is about bringing Malaysian bioethics to the center, highlighting Malaysian bioethics in the international scene. It's going to be different. Like we saw the 3 topics I showed, the conclusion was different from international bioethics. Alright? And because of that aspect, the 3 papers got published anyway in ISI. And then there are also citations to those papers, meaning that it offers fresh perspectives and it also extends other people's research. Alright, but the first question I didn't get, the first part of your question?
What would be the benefit of your study to the community?
The benefit, okay. It's about, asking us to rethink and recollect, or recall again the professional, the medical profession, the moral values behind the medical profession. Okay, just now I think Prof Zawidi was talking about today, say clinicians all are out to get maybe research grants, many research grants. They forgot that the respondents or the participants of their research are also human beings. So it's about respecting those human beings themselves. So any research ought to be made with the objective of helping society, not actually trying to get a name for yourself as somebody who publish widely. So that will be actually, so that in a sense is the significance of my research. So I'm trying to bring in more thinking on the aspect.
I'm interested with what you have mentioned that as regards stem cell, the Catholics,
Yes.
they are
Yes.
do not agree.
They do not give, the Catholics.
So, but the other religions,
The Protestants, you mean, or the
Why?
other group?
why?
The
Why?
Hindu.
Why? I'm interested to know the reason why they do not confirm with or they do not want stem cell.
Which one?
Any reason why?
Catholicism?
The Catholics,
The Catholics.
they are
Because they believe that
for
the
stem
embryo is a living being. The embryo is a living being, and it must not be terminated or disturbed in any way. So the embryo must be allowed to continue to live. So, but by doing research, the minute scientists do this research on stem cell, you actually destroying the embryo. So that is the tricky position. So knowing when lives begin is important in embryonic stem cell research. For the Catholics, the first day is when life is already present, but for the say Muslims is a bit later, and then for others it's a bit later. But the medical the medical line, okay, so the time at which life begins for say biology. So in the biological science will be 14th day. Alright, so there is time to do research on the 14th day, alright, and research is not encouraged after the 14th day. So for the Buddhist and the Hinduism, I think there's no problem there to conduct research because the promoting knowledge and also say alleviating the suffering of people is more important than when actually life begins, like that. So that's what was gathered by the study.
I wonder who are the respondents. Are they medical practitioners?
The respondents are religious leaders. They are not medical practitioners.
Okay.
Religious leaders. Okay.
Leaders.
Yeah.
Really,
Yes,
leaders.
the guru. Yeah, the first person, the first authoritative figure. Okay, in Buddhism or Hinduism, the first authoritative figure in the organization in Malaysia.
Because it might be of interest to know the perception of Catholics of different professions.
They usually, the Catholics usually follow the Vatican rule. Okay, they do not deviate from the Vatican rule regarding when life begins. So, therefore, they have sort of now stood firm on that ground, and they did not in a little bit why, even though the student tried to talk about the importance of alleviating suffering. The Catholic will say there are other ways, okay, there are other medical treatment that you can do instead of using stem cell research technology. Right? They're always thinking that there are other ways. Okay, this is not the only way. So probably unless there is no other way in which you can save human life, then probably the Catholic will say okay, probably, right? But that thinking still remains until today. Yes.
Just in Malaysia, right, that you mentioned the religion perspective.
Pardon?
From the
Okay.
just in Malaysia, right, I just relate to the Anglican.
Yes, alright, yes. In Malaysia. But it will be different in your country, I think. Ananya? Will it different? Is it different or the
I
same?
think in Thailand the stem cell is
Accepted.
Yeah.
I think so. Because land of you.
But probably it did not go to the, there was no religious study regarding it.
and not get information from the religion,
Yes.
but for the commercial or for the general or social, I think in Thailand we accept about the stem cell. In the commercial part, even for the treatment or physical.
Yeah, that's why this is very interesting. Also, first time for me to
Yes, in Malaysia,
To
stem
learn
cell
that.
research, is going on. It is going on. But the only prohibition is that no new stem cells can be created in Malaysia. Okay, stem cells are being imported, into the country. Scientists work on that. Scientists are not allowed to create their own stem cells for now. So there is some monitoring in that aspect. Alright. Okay.
So you use secondary data. Use all these examples are done by other people.
Do I use secondary data? It will be something which has been published in papers. Yes, I'm also an author there. Alright. So like what Dara said just now, I probably will have to get consent from my co-authors to be able to write down this thesis. Alright, and but the way I am analyzing the data will be different from any of the thesis. I'm just saying this is a fresh perspective on bioethics thinking, so that my conceptual framework will be different from what was presented in those papers anyway. So I think that will constitute original, will it, Daryl?
Yes, I think so. Yep.
So for your for your particular study, who will be your respondents?
Oh, for me, it will be literature.
Documentary
research.
analysis.
Yes, exactly. Documents. Okay.
Okay, now sounds a good project.
Is it? All right.
And
okay.
also, in a sense, putting together some of your philosophy of graduate supervision
Yes.
articulated into a position which can be shared more.
That's why it's called a biohistorical and authentic account.
And what countries for the documentary analysis, will you utilize
I will concentrate on Malaysia.
Malaysia?
Yes. Later somebody can do a comparative study with Bangladesh. Okay. Alright. Or Philippines or Thailand.
Are you going to compare that using other
Yes, of
you know,
course. There
information
will
from
be
other
there will be a
countries?
literature review. Definitely there will be a literature review.
Because it would be good for to benchmark or to
Yes.
see what others are thinking.
Yes. Probably I wouldn't know. My literature review will show something very interesting, I think. Yeah, that's good thinking, Prof.
Yeah.
I think I'll take your note on that.
Because you want to input something new
Yes.
in Malaysia. Because if it's just Malaysia, then better to get some ideas.
Yeah,
and
because
compare.
in any academic thesis, you have to give your limitations and the scope.
Yep.
My scope is looking at those research on bioethics research done in Malaysia. So I already set my limits and my scope. I think I'm fine there. Alright? Unless I do not scope, I do not limit. For example, I take some Malaysian article, some Indonesian article, then I'm really opening myself to danger, I think. So, but as long as I scope myself, I meet my limitations. Of course, there are weakness there. Maybe I should be comparing with other countries, but this is my limitation which I have set for myself, and I think that thesis is fine.
Yeah. Because it's documentary analysis and you have references, so I think it's safe.
Yes. Alright. Yes, Ida.
I want to know that how philosophical discussions are involved in bioethic issues in Malaysia because of conflicts in between religion and philosophical ideas, especially among the extremists.
Alright, just now you listened to Professor Siti Howard. She spoke something about racism in a harmonious way. Okay, something like that. So in Malaysia, that is essentially it. So it's about respect towards each other, respect for each other's values. So in the end, the policy, that is being developed actually gives due respect to all the religions. Actually, opinions and views are taken from those religions, actually before they come up with a policy regarding any SNT innovations. So there is usually, so far there is no conflict because no one was murdered, for one thing, and no one was discriminated against. Basically, those are the basic values that Malaysia would look out for. Yes. Okay, thank you very much, everyone. Thank you for listening.
Thank you very much, Siti.